പ്രിയ പ്രേക്ഷകർക്ക് മെഡിട്രാക്കിലേക്ക് സ്വാഗതം. ഇന്ന് മെഡിട്രാക്ക് ഡിസ്കസ് ചെയ്യുന്ന വിഷയം പ്ലാസ്റ്റിക് ആൻഡ് റീകൺസ്ട്രക്റ്റീവ് ആൻഡ് കോസ്മെറ്റിക് ഡിപ്പാർട്ട്മെൻറ്റിനെ കുറിച്ചാണ്. ഈ വിഷയത്തെക്കുറിച്ച് കാസർഗോഡ് വിഷൻ്റെ പ്രേക്ഷകരോട് സംസാരിക്കുന്നത് മാംഗ്ലൂർ ജ്യോതി KMC ഹോസ്പിറ്റലിലെ പ്ലാസ്റ്റിക് ആൻഡ് റീകൺസ്ട്രക്റ്റീവ് സർജൻ Dr. Gautham Shetty. Sir, welcome, sir.
Thank you. Namaskaram.
See, sir, could you please explain about your department?
So, I am Dr. Gautham Shetty. I am a consultant plastic surgery surgeon which deals with cosmetic and reconstructive surgeon. I am available in KMC Jyoti.
Actually, what does a plastic surgeon do?
What does plastic surgeon do? The plastic surgery as such, what does it mean is, it can mold the body.
Yeah.
The plastic cost means, in the Greek terminology, it is called molding. So, it is in a subspecialty where in the plastic surgery we deal with reconstruction and cosmetic part.
Okay.
So, the reconstruction part is the main aim is to get the form and function of the body. Whenever, if any, for example, if there is any birth defect, so we have to correct that deformity and get their normal function as possible, as early as possible.
Okay.
Cosmetic surgery as such, we increase the appearance and help their self-esteem to their patient's need as such.
Sir, see, actually the main difference between plastic surgery and cosmetic surgery, what is the main difference between plastic surgery and cosmetic surgery?
Plastic surgery are the patients who are mainly for the reconstructive types. We have a subspecialty, reconstructive part and cosmetic part. The reconstructive part, it can come from anywhere, any part of the body, anywhere from scalp to toes.
Okay.
For example, if the child has got some birth defect, like cleft lip palate or birth marks or birth mole, so sometimes they wants to get rid of it. So for example, cleft palate means there is an hole in the palate.
Correct.
So the child gets to speak as early as possible to get their normal function. So we repair with that as early as around 1 year of the age to get their normal speaking, so that they can interact with their peers when they grow up and I'll have a normal leading life. Whereas in cosmetic surgery, the patient, they don't have any problem as such in their function or whatever it is there. The main problem is their appearance. They want to get good appearance and to build up their self-esteem and self-confidence to interact with their own peers or the public as such.
See, doctor, different types of reconstructive surgery. Which are the different types of reconstructive surgery?
As I said earlier, the reconstructive surgery, so it starts from head to toe. So we deal with every part of the skin, subcutaneous tissue or muscular tissue or the bone. For example, for head and neck, we deal with craniofacial reconstruction surgery. This craniofacial reconstructive surgery can start from early as from birth defect to any trauma or any cancer reconstruction. For example, in CA tongue or CA lip. So what does they do? It is an interaction between an oncosurgeon and a plastic surgeon. The oncosurgeon will deal whatever the cancer part. So whatever he removes after that, there will be a defect. So for example, tongue. So the half part of the tongue might be gone. So to reconstruct that type of tongue and to improve their function for eating or any speech as such, so we reconstruct the part of the tongue. That is part of a reconstructive oral reconstruction.
See, the one doubt. See, after the procedure, after the reconstructive surgery, see, will we get the same? What will be the result?
Our aim is to get near normal as such. The main aim is to get the function. Not the real look as such, because whatever the cancer or other defect as such, to get near normal as what was earlier as such. So we will get the main aim is to get the function, and as the
functions the same way naturally how they got earlier,
they will get.
and is there any chance to get the same thing?
Yeah, it's almost possible.
Yeah.
It depends upon the type of surgery we do.
Okay.
If it is small lesion or small cancer as such, it is almost 90 to 100%. They will get the near normal or near function, normal function as before as they were.
Okay. See, sir, you just mentioned about regarding cancer patient. See, suppose in such a case, if cancer patient have this kind of, when they are undergone this kind of reconstructive surgery, see, what will be the results, sir? We know that suppose certain organs will be, almost they are not in properly working position. Such a situation, such a scenario, how it works?
This I am talking about the oral cancers.
Yeah, correct.
See, the oral cancers as such, they have got good prognosis,
progressive result.
Yeah, progressive result. Their survival rate, or that depends upon each individuality and type of cancer also.
Correct.
So, as early stage 1 or stage 2 cancer, the patient ability to come to their normal as before, it is almost 80 to 90% as before.
Correct. Okay. See, let us take the cosmetic surgery. You have already mentioned about the cosmetic surgery. See, which are the different types of cosmetic surgery?
The cosmetic surgery as such, mainly facial aesthetics we call as, and in early teen and adolescence age, some people will have extra breast tissues in male, like called gynecomastia.
Yeah.
So this is around the adolescence age group.
Yeah.
So they are more keen of, they are not able to enjoy their public life or wearing t-shirt or wear swimwear and all. So that is the one gynecomastia.
That means enhancing that.
No. It is an it's like an hormonal imbalance. Usually at the age of 12 to 18 years, there is an imbalance of sexual hormones.
Okay.
So some people may have extra breast tissue, especially this is about the males.
Okay.
So we call that extra breast tissue is called as gynecomastia.
Okay.
So sometimes around the age of 18, if the breast tissue is more and it is not gone in any other means, like they do exercise or any fasting as such. So we have to deal with that type of gynecomastia either by surgery, we call as liposuction.
Okay.
So anywhere, any other part of the body, excess fat tissue deposit in particular area like abdomen, arms or thigh, that you can see in both the sexes, male or female. So we can deal with that type of cosmetic surgery. And as the age advances, the skin laxity will come down. It's most probably around 40 to 50 years of age. There will be facial wrinkles, sagging of eyelids, and to get the facial regeneration. And some people will have hair loss. Some people have projected ear. So that type of cosmetic surgeries we can deal with.
Okay, see, you have mentioned this. See, we are discussing about cosmetic surgery. See, sir, regarding hair loss, what kind of procedure you are doing here?
We do hair transplant. It is called as the follicular unit extraction. So basically, what we do is from the back of the hair. Basically, we remove the patient's own hair from the back of the hair. It depends upon how many grafts we require on each follicle. So back of the hair, it will be very permanent. As you see, as a old age, some people will have the back of the hair. So that is long standing and effective. So what we do is we remove the hair from the back and put it to where the deficient is. It can be in the scalp, or it can be in the mustache or in the beard. So that procedure is called as an hair transplant. Depending upon where the deficient of hair it is, or where the patient requires. If the patient wants beard or mustache, where some people don't have mustache or beard, so they don't want hair to grow. So we can hair transplant to that part of that body where they require.
Okay. See, sir. If the area is small, especially hair falling, that if the area is small, then what will be the procedure? How long it will be, or how long that procedure will be?
This hair transplant is done on an outpatient basis or nothing but by a daycare procedure.
Okay.
Prior to that, we consult them and we assure them what type of procedure it is.
Okay.
Reassure them and where and all the grafts are required. We have to speak to the patient first.
Okay.
So we do some basic investigations.
Okay.
And so once the basic investigation is fit and it is normal, we tell them on the day to come, and it takes at least some 6 to 7 hours.
Okay, that's
So at the end of the day, morning if they come down, by evening they can go back to their place and it can be discharged.
See after the procedure, how long does they maintain these ones? I mean, see after that, after the procedure, after 1 month or after 2 months, see if there any negative result will come. I mean, again started the hair falling.
Any surgery has some, all surgeries has some risk and little bit effect.
Okay.
I mean to say little bit of swelling, pain, little blood loss will be there.
Okay.
That is normal for any surgeries. But we reassure them what precautions to be given post hair transplant or post any surgery as such. So we tell them to put some ointments or any spray for the to decrease the hair fall. And
it should be continuous. Sir. See after the procedure.
That is for initial for 2 weeks or 3 weeks. Then after 5th day onwards, they can have an head bath with a shampoo. That we'll give some guidelines or some brochure as such, what to do and what not to do during procedure and after the procedure, and how to take care about the hair and how to take care about your body, which part of the surgery they are going to do.
So any need of taking any medicine that should take after the procedure?
What procedure?
Yeah, this you have already mentioned a hair transplantation.
So the hair spray it comes.
Yeah.
That means to increase the nutrition of the hair. So we give a spray which has to be taken for at least a year or 2.
That's all. Yeah. See regarding cosmetic, see already.
And you have to maintain their hair actually. Means maintain hygiene means you have to take bath and keep it dry also.
Okay. See during this procedure, either this were reconstructive surgery or in cosmetic surgery or in plastic surgery. See what are the risk patterns?
Risk as such, there are risks in every surgery.
Yeah, correct.
So it depends upon where you get operated and what expertise you have.
Yeah.
If you have got good expertise in your hand and was well trained in any plastic or cosmetic procedure, whatever the risk factor is negligible to what he has gained from that whatever surgery he has performed.
Okay. See sir, that regarding cosmetic surgery, there about female things that you have already mentioned, various cosmetic surgery done in female. Concerned about the male side, sir. What are the cosmetic procedure doing here?
One is, I said, the gynecomastia.
Correct.
Where you do liposuction to the, we remove excess fat through that liposuction.
See after liposuction you have done, sir. See once we done, see again is there any chance of getting back this one? So
once you meant to say extra fat again it will grow.
Yeah.
Now once we remove that area of the fat will not come because we are removing the fat cells.
Yes.
So whatever extra other than the fat we are not removed, there may be a fat deposition.
Yeah, okay.
But if they are keen on fat surgery as such, they will have their diet regimen and whatever exercise they do. So that it will not be regrow as such after any liposuction procedure as such.
Okay. See after this liposuction, then what are the other procedure for men, sir?
The procedure, it depends upon what they need actually.
Okay.
If the patient wants facial regeneration or facial, if they want their nose correction, it is called nothing but nose job or rhinoplasty. So that rhinoplasty can be done to improve their aesthetics of their nose.
Okay.
That is the one. And for the male, if you want any dimple, some people want eager to get a dimple.
Okay.
So that can be created.
Okay.
And all these age-related changes like lagging skin and around the around the eyes, there are a lot of boggy swelling. So we can tighten that area or any lagging skin around the face or the neck, which called as facelift. That procedure can be done. That is usually at around the age of 50 years of the age.
See, you see this kind of lagging thing that after the procedure, sir, what will be the result? How it is? See, there is, again I am asking that out. After the procedure, after 1 or 3 years, see the same kind of result. It will be.
See, as aging, it is. As aging, we can't stop the aging.
Yeah, correct. Yeah.
Whatever what aging has done to your skin or this one, we can tighten it.
Okay.
The aging is a natural process. It will go on.
Okay.
So the tightness will be there.
See, my doubt is this one, sir. After 1 year, see, again we should do the procedure for improvement.
No, it's not required.
Not required.
Not required.
Because you already mentioned the age. We cannot stop the age.
We can't stop the aging. Because of the aging, that depends a lot of factors for that also.
Yes.
If you done procedure also, if patients smokes and lifestyle habits are little bit on the other side of the this one. So there will be a little bit of skin lagging. So that for that also we can do some facial regeneration, like not surgical. We can do some fillers or Botox injection as such to improve that facial regeneration.
See, sir, we can see the natural, whether it is male or female, we can see that that protruded chin and see projected nose like that. See, what is the importance or what is the role of reconstructive surgery there?
Role of reconstructive surgery, as in protruding chin, they have deformity in their upper jaw and the lower jaw, so that they will not able to chew their food properly. So what happens that the appearance also will be little bit not normal as other individual. So that type of chin surgery or mentoplasty, or some is called as orthodontic surgery, that can be corrected by a reconstructive surgeon. Or if any cosmetic is there, we can put a chin implant or we can adjust the chin depending upon how much has to be retracted back or put forward.
See, sir, see this chin implant, you said that word. Is it a team, a team of doctors or the cosmetic?
It is usually a team of doctors, usually in the facial maxillary surgeon, or we depend upon the orthodontist. We have to see how much of the jaw has to be put forward or put backward. So we have to study in prior before doing any surgery to the patient.
Okay. See, sir, you mentioned many things that in cosmetic surgery, then reconstructive surgery, plastic surgery, what is the role and what is the importance of that one? See, sir, before going to do the procedure, did you counsel the patient, sir?
Yes, we do talk to the patient, because that is the first ideal interaction between a patient and a doctor. So we have to study the patient, what he wants, what he requires, whether it is feasible or not. Some patient will have, they may say, I want this type of nose. That is not so feasible as such. But we can change their appearance and to increase their self-esteem, we can change to the near normal as such, not to the extent as what is their requirement as such. So the counseling of the patient and what their requirement has to be studied first, and then we will give you our report. What can be done and what can be achieved. That is our main aim.
Okay. So, Doctor, let us wind up the program. We have already almost discussed all the topics. മെഡിട്രാക്കിൻ്റെ ഇന്നത്തെ എപ്പിസോഡ് ഇവിടെ വൈൻഡ് അപ്പ് ചെയ്യുകയാണ്. ഈ എപ്പിസോഡിൽ കാസർഗോഡ് വിഷൻ്റെ പ്രേക്ഷകരോട് പ്ലാസ്റ്റിക് സർജറിയെക്കുറിച്ചും റീകൺസ്ട്രക്റ്റീവ് സർജറി, അതോടൊപ്പം തന്നെ കോസ്മെറ്റിക് സർജറി, ഇതിൻ്റെ പ്രാധാന്യം, ഇത് ചെയ്യുന്ന രീതി, ഈ പ്രൊസീജിയറിനെ കുറിച്ചൊക്കെ വളരെ ഡീറ്റെയിൽ ആയിട്ടാണ് മാംഗ്ലൂർ ജ്യോതി ക്യാംസി ഹോസ്പിറ്റലിലെ പ്ലാസ്റ്റിക് റീകൺസ്ട്രക്റ്റീവ് ആൻഡ് കോസ്മെറ്റിക് സർജൻ ഡോക്ടർ ഗൗതം ഷെട്ടി പ്രേക്ഷകരോട് സംസാരിച്ച എല്ലാ പ്രേക്ഷകർക്കും നന്ദി, നമസ്കാരം. താങ്ക് യു, ഡോക്ടർ.